multiple sclerosis.
Multiple sclerosis.
Multiple sclerosis.
With multiple sclerosis.
Multiple sclerosis.
What is multiple sclerosis? A potentially disabling disease involving the brain and spinal cord of the central nervous system. When someone has MS, their immune system attacks the protective myelin sheath, causing communication problems between the brain and the rest of the body. It can cause severe and permanent damage to the nerves. Causes of the disease remain unknown after over a century of study. It can be indicated by studies that a viral infection may be important to the cause of the disease. There is evidence of an important genetic influence on susceptibility of the disease. Signs and symptoms: vision problems, numbness, fatigue, difficulty walking, bladder problems, muscle spasms, cognitive or speech problems, and emotional changes and depression.
Miss Martini, what brings us here today?
It's been fine, but the kids have been driving me insane lately. You know, I just want to get that clean bill of health from the doc to show that I'm A-okay.
What's been going on today?
Nothing out of the ordinary, just falling a lot, sometimes seeing double, and I sometimes lose feeling in my right leg. But it's no big deal. Oh, and sometimes I get muscle stiffness. But other than that, everything's been perfectly fine.
Let's get you ready for that MRI, okay?
Diagnosis. There are no specific tests for MS. A diagnosis often relies on ruling other conditions that have the same signs and symptoms of MS. This is called a differential diagnosis. Diagnosis. Tests. Blood tests, used to rule out any diseases with similar symptoms. Spinal tap. Fluid is taken from the spinal cord and tested for antibodies associated with MS. MRI. Can reveal MS lesions on brain and spinal cord. Evoked potential tests, used to measure how quickly information travels down nerve pathway. MRI scanning. Contrast helps to assist in viewing inflammation in the brain. Key characteristics that lead physicians into diagnosing patients with multiple sclerosis is by identifying widespread inflammation, focal demyelination, and a degree of axonal loss in their MRI scan. The number and spread of lesions throughout brain tissue is a crucial component in assessing the progression of a patient's multiple sclerosis status. Plaques or lesions develop in response to the damage occurring within the brain. With enhancements in technology, specifically brain imaging techniques, the evaluation of these lesions can assist in treatments that are suited to the progression of the disease. It is important to have updated MRI scans done to track the progression of the disease since it can indicate new damage and inflammation. MRI scans can provide information on your past disease, ongoing disease, and potential prediction of your future.
All right, so you have multiple lesions along your brain and spinal cord, but I'm going to have to stick you with this needle. Okay?
What?
All right, here we go.
Let's get that clean bill of health, doc. What do you got for me?
Well, unfortunately, I'm not able to assist you in straightening your kids out, but I am going to prescribe you some beta interferons to help you with your multiple sclerosis symptoms. How do you feel about needles?
What's really going on? The immune system's contribution. The T cell, a white blood cell that is a part of our immune system and fights viruses and assists in maintaining health. T cells may be autoreactive, meaning that they are produced by cells within an individual and can attack against its own cells or tissues. T cells and multiple sclerosis. In multiple sclerosis, some T cells begin attacking the brain and spinal cord. It is not yet determined as to why this occurs. How does this happen? First, T cells exit the bloodstream and enter in the brain and spinal cord. By the help of adhesion molecules, T cells secure themselves to the blood vessel wall. Next, T cells release VLA4 that plays as a key component in cellular adhesion, which helps the T cells firmly anchor themselves to the cell wall. Next, once they are anchored to the blood vessel wall, they secrete metalloproteinases, a matrix that helps them enter into the blood vessel. T cells are released into the blood vessel and travel into the brain and spinal cord, where there are dozens of nerve cells. Next, the T cells release cytokines, which signal for macrophages and B cells. To prevent damage to the nerve cell, oligodendrocytes then rescue the nerve by wrapping itself around the nerve cells to make new myelin. Oligodendrocytes need time to repair the myelin, which explains why recovery from attack can take quite some time. Time is critical for this attack on the myelin sheath. As T cells continue to release cytokines, the more difficult it will be to repair the myelin. Extensive damage to the myelin sheath will ultimately penetrate to the nerve itself, altering the nerve's ability to effectively send signals.
today's visit, we have a follow-up patient coming in for her relapse-remitting MS. Today marks the 6-month mark from when she was initially diagnosed. The patient has been engaging in stretching and strengthening exercises, as well as injecting beta interferons and glatiramer acetate. Beta interferons help the frequency and severity of relapses. Glatiramer acetate helps MS patients by blocking the immune system's attack on myelin. At today's visit, we have done an MRI, and we are going to be discussing the results. So sorry to keep you waiting. Tell me, how are we feeling?
Well, I was wondering how I could get some of those happy pills I heard someone in the waiting room talking about. Okay, fine. Starting physical therapy has been super helpful, but I still find myself having difficulty getting words out and walking fluidly.
Well, your new scan showed that you had new lesions that had developed. How about we up the dosages of those medications?
Sounds great.
Perfect.
Statistics. There are approximately 850,000 to 950,000 people living in the U.S. with MS as of 2017. MS is about 3 times more common in females compared to men. Most people receive diagnosis of the disease between ages 20 and 50. Rates of MS are higher the further you travel from the equator. Treatments for signs and symptoms. A wide variety of medications are used to manage symptoms of MS. Some symptoms that are treated are bladder problems, bowel dysfunction, depression, dizziness and vertigo, fatigue, emotional changes, walking difficulty, tremor, and pain and itching. Progression and types of disease. Relapsing remitting MS. People with this have periods where symptoms get worse called relapses, followed by full, partial, or no recovery. Primary progressive MS. Symptoms gradually get worse without any obvious relapses or remissions. Secondary progressive MS. It usually starts as relapsing remitting MS. Over time, the symptoms stop coming and going and begin getting steadily worse. Progressive relapsing MS. It is the least common form. Symptoms get steadily worse, but people may have flare-ups that may or may not be followed by some recovery. Treatments. Corticosteroids, prescribed to reduce inflammation, have side effects including nausea, high blood pressure, fluid retention, and mood swings. Plasma exchange. Liquid portion of blood is removed from your body and mixed with a protein solution and put back into the body, used to treat MS with new symptoms. Treatments to modify progression. The U.S. Food and Drug Administration approved several disease-modifying therapies to reduce relapse, delay progression, and limit new disease activity. These include injectable medications, oral medications, and infused medications.
Here we have today Gabriella Martini coming in for her year-mark follow-up visit after being diagnosed with MS. Due to her having relapse-remitting MS, she will go through periods of new MS symptoms and nothing at all. From her scan about 6 months ago, new lesions had developed. Today we'll be tracking her medication progress. Ms. Martini, how have you been feeling?
Alright, here we go.
Turns out the lesions along your brain and spinal cord have not been accompanied by any new ones. Feel okay?
5 changes in an MRI. 1. T2 and flare lesions. Make MS lesions in the white matter stand out as bright spots, commonly called hyperintensitites. Lesions for MS are commonly located deep within the brain near cerebrospinal filled cavities called ventricles. Lesions are mostly oval and frame-shaped. Lesions can also be scattered within the white matter, specifically along the cortex. T2 and flare lesions are due to old damage and new inflammation. T1 and flare lesions. T1 and contrast lesions. Contrast is given intravenously. The contrast enters into the bloodstream and seeps out of blood vessels to areas of active MS inflammation. Some people with MS may have many T1 with contrast lesions and some may have none at all. T1 with contrast lesions. Three, T1 with black holes. Dark spots on T1 scans are areas that have damage to the myelin coating and nerve themselves. Black holes found on scans are also known as hypodense lesions. These plaques are most severe. Those that have these are at high risk for disability. T1 with black holes. Number 4, atrophy. As people age, the brain shrinks and a noticeable reduction in brain volume is documented. People with MS, atrophy accelerates the speed of this process. It is difficult to measure atrophy on a routine brain scan. Atrophy. 5. Cortical lesions. Gray matter on the brain surface display lesions. Nerve cell lesions on the cortex are difficult to spot on a typical brain scan, but new technological advancements have changed the way these lesions have been identified. Cortical lesions are common in patients with progressive disease. Cortical lesions. Changes in MRI activity due to MS treatment. Medications prevent over 70% of new lesions from developing and monitor existing lesions from progressing on T2 and FLAIR images. Contrast T1 can decrease over 80% by medication. It can slow down atrophy and prevent new T1 black holes.
Feel okay on the medication? Keep up the physical therapy and administration of drugs, and I'll be seeing you in 6 months. Feel free to call at any time.